Chi will rock you. Dun, dun, dun. Chi will rock you. Hi guys. Hi there, welcome back to my channel. If it's your first time, I'm Clara and I create acupuncture and Chinese medicine content for practitioners and students, making it easy to grasp and fun to learn. If you're watching the replay right now, the timestamps will be in the description below the video and you can bypass the next few minutes where I connect with all the people that took the time to show up live. Hello everyone. So I just need to see everybody. Hi guys, hi and hi. Just want to make sure I see everybody. Hi Nadir, hi Chan, look at you. Here we are again. Yes, we are here. So thank you for showing up. I know this was kind of like a little bit impromptu, last minute. I didn't announce it too much this time. I didn't tell. I just kind of sent a quick email, but I think everybody was just, I know a lot of people are busy right now and it's a last minute kind of thing. But I'm so glad you guys are showing up and you're here to keep me company. So thank you for coming in. I never done a Q&A before, so I didn't know if that was going to resonate with people or not because it's not a subject. And I know people, when people like a subject, they're going to be more prone to come and show up and ask questions and participate, etc. But I'm happy you guys are here. And I think that, you know, Q&A is always good because sometimes we have questions that we want to ask and we never get the opportunity to ask that question or to have an answer, right? And sometimes an answer can be very long. Like I have a lot of people that will DM me on social media and ask me a question that would require me to talk for like 20 minutes, right? Which we can do here on YouTube, but we can't really do this on a DM because I can't write that much on the DM, right? So I'm glad you guys came in and you are here. Thank you for your support. I really appreciate the time. So hi, Paul. Hi. We just emailed this morning. We were emailing back and forth. So hi, Paul. I know obviously it's probably later where you are as well. So a lot of people, I know it depends where you are. It is a beautiful day in Vancouver. Finally, it's not raining. It's spring. It's a beautiful day. And my puppy got neutered a few days ago, so he looks pretty sad. He's got a big cone behind his head and he's on the floor there. Very sad. Hi, Naresh. Hi, Andrea. So it's kind of like, you know, it's a tough time for him, but I think it's more of a tough time for me. I don't like to see my puppy feeling sad and looking all weird with his big cone on his head, but, you know, it's got to be done so he can be, you know, healthy and happy again. So that's what's happening in here. Hi, you guys. And again, thank you for coming and saying hello. Everybody else that is here, please come and say hello. I love to see who's here, where you are from, or where you're watching from, because what I love about Chinese medicine is it has no boundary, right? And we can totally connect from people all around the world. So I absolutely love that we can do this and connect with our love of the same medicine, which is so impactful. So today, like I said, is a Q&A. So what I wanted to do is whenever you have a question, put it down in the chat and ask me the question. If you don't have a question right away because you're shy or you're waiting, and I totally get it. Hi, oh my God, from Iraq. Well, that's fantastic. Look at you in the Middle East where it's always sunny, right? Which I love. It's always sunny. My puppy just got neutered a few days ago. Oh no, Leo, you too. Okay, so we're bonding with the puppies feeling so sad right now, but I know they're going to get better, right? So hi from sunny Florida. Oh my God, you guys are all in sunny places. This is great. But like I said, it's sunny in Vancouver, right? Rosina from South Africa. Woohoo! All right, all the way down. I know in South Africa, depends where you are. It could be raining in some areas because you're kind of really south, right? So it can get cooler in the winter. So, and we got 2 people from South Africa. Look at that. Sontaga as well. That's awesome, you guys. I love it. So thank you for joining me. If you have any question, this is the time to type it. And I'm going to wait for people to get their, what is it called? Their, strength and courage to type a question. To me, when I teach students, there is no wrong question. There is no bad question. Question means you want to learn. And I absolutely love any kind of question. What points are best after COVID-19? So that's Chun's question. What points are best after COVID-19? So that's a good question. Let's start with that since we're in the middle of a pandemic. So anybody that's watching this later on, maybe someone will watch this in 20 years and go, what? Yeah, we are in the middle of a pandemic for quite a while now. So COVID-19 creates a lot of fatigue. So let's talk about this for sure. So that's my first question from Chen. I am going to put my board up. How do you like my George? George's pretty nice, right? I figure I bring George and we are together presenting together. So let's talk about COVID-19. So first of all, when someone had the virus, right? So there's two ways to talk about this or look at this. The first thing is if you haven't been sick and you haven't contracted, and I hope you did not, got COVID-19, it's to strengthen our Wei Qi, our immune system, our defense system, right? So we have a strong barrier, but we also have our immune system that's strong enough that if by chance or by, we get sick, we can fight it better. The stronger we are, the better we can fight it, right? And recover as well. So that's why it's affecting older people. It's affecting people that have a weak immune system, people that have disorders, diseases that makes them weaker in general. So the healthier we are, the easier it is for us to hopefully recover the best we can, right? So that's really important. So let's start by preventative medicine, right? Because I think TCM is very good with preventing. That's one of the things that I love about TCM. So we want to strengthen the Wei Qi, the defensive Qi, the immune system, right? So anybody can do. Remember that in TCM, we always have to make a diagnosis, right? It's really important to have your TCM diagnosis for each patient and follow that diagnosis for each person. But having said that, there are basic points that we can do on all of us, on each other, on everybody, on patients, to make sure that the immune system stays strong. So the two best points are stomach 36 and lung 7, right? Those two are going to strengthen the Wei Qi, the defensive Qi. So those are really good to implement, right? So that's the first thing. The second thing is to have a really good healthy diet that is tailored to the person. Each person's diet is very unique to who they are. It's like TCM diagnosis is very unique. So if someone is cold all the time, they need warm diet, right? Like broth and soup and stews compared to someone that's hot all the time, where they need a bit more cooling. But no matter what, it's good to have probiotic in the gut. So fighters, antigens, probiotics are going to fight the bad bacteria, right? And so it's good to have a really good diet to do that. That's for bacteria. For viruses, it's a different story. But what I wanted to say is it is really important to follow the diet that's unique to the person. We need to sleep. Sleep is important because if we don't sleep for many days or weeks, it'll deplete the immune system. So preventative, right? The lifestyle we have is going to keep us healthy. So diet, sleeping well, finding ways to de-stress, because stress also depletes the immune system. That's been proven over and over. So finding ways to de-stress, right? Whatever it is that works for each person. Maybe it's singing, maybe it's hiking, reading a book, meditating, qigong, tai chi, yoga, anything that calms us down. Hi, Lily. Hi, Liana. So I'm glad you guys are here too. Lily goes, I'm in a family dinner. That's okay. You could just tell them, sorry, I'll be back in a few minutes. No, I'm kidding. So we're just talking about how we can boost our immune system to keep it strong. So if there is a virus or bacteria, we can handle it better, right? Or hopefully keep it at bay, right? That's the idea. TCM also has a formula called, and don't ask me to pronounce Chinese properly because I don't pronounce Chinese very well at all. I can't speak Chinese already. I can barely speak English as it is. So, Yu Ping Fan San. So Yu Ping Fan San is a preventative formula. It only has 3 herbs, which is Huanxi, Fengfen, and Baiju. So hi from Nova Scotia. Hi. So Yu Ping Fan San is a really good formula. San means powder. So sometimes you may see Yu Ping Fan Wan, which means pellets. But those 3 words, Feng is wind, right? Yu Ping Fan Song is Jade, so U is Jade. Jade, the translation is Jade Windscreen Formula. Okay, Jade Windscreen Powder. So think of this, jade in ancient time and still today, jade is really a strong stone. So in ancient time, what they would do is when someone dies, they would preserve them in coffins made of jade because the jade was strong enough to preserve the body and not let anything enter or penetrate, like anything that's underground or anything else. So jade was a very strong. So jade windscreen, this formula comes from the fact that it stops the wind, it stops the external wind, which brings more external pathogen into the body. So when we have wind heat or wind cold, which could be a bacteria or a virus, it comes in with external wind in TCM. And so the screen is stopping from the pathogen from entering. So it is a shield kind of formula. That's what it is. It's jade, it's strong. It's like our shield to try not to get sick, right, with viruses and bacteria. So this is a really good formula. Again, it has only 3 herbs in it. But I want to say the caveat with this formula is if you're already sick, you shouldn't take it because it's going to make the pathogen worse. So if you have a cold or a flu, you don't want to take this formula. It's going to make it worse. This is just if you want a preventative. So this is a formula to use to strengthen your immune system in order to ward off anything. Like it's like vitamin C. It's like to strengthen it, but do not use it if you're already sick. Also, it's got astragalus in it, which is Huang Qi, and astragalus is really good in strengthening Qi, in lifting energy, and also defensive Qi or Wei Qi. So that's what this formula is used for as a preventative health measure. This is a good formula to take before winter to strengthen our immune system for the fall cold and flu seasons. So hopefully that answered the first question that Chen had regarding. So Chen, for people that just joined us, had the question, and this question was, what points are best for COVID-19? Okay, so we've talked about preventative. Now let's talk about post, right? So what I would do, there's other things to talk about when it comes to COVID-19. And one of the things is people are very stressed about it, very anxious about it, very fearful. And everybody has degrees of fear, anxiety around the whole virus. Everybody is different. We all have our own way to handle this whole pandemic, and it's okay. Everybody is handling the best they can to their ability. So what I think is best is to reduce the anxiety and the stress, right? So points that are great for anxiety, stomach 40. I love stomach 40. It's one of my favorite points. PC6 for anxiety as well. So that kind of brings down the fear. Also, another one that a lot of us sometimes forget is kidney 4. Kidney 4 is really good when there is massive fear or phobias, right? And with COVID-19, there is definitely fear and phobias from viruses, right? So strengthening the Wei Qi, the defensive Qi is great, but reducing the anxiety, the fear that comes with it, is a good idea as well, right? So in kidney 4. So those are the 3 points I would use for perspective of anxiety and stress. And of course, you can de-stress the patient using also the TCM pattern of diagnosis. It's super important to make the right diagnosis, right? So that would be it. Now, post-virus, if someone had the virus, we want to strengthen them. We want to strengthen their Qi. We want to strengthen their blood. We want to strengthen their whole body. So we want to tonify them, right? And so, again, we could still use stomach 36 and lung 7 because it tonified Qi and specifically the defensive Qi. But we probably would add up Ren 6, Spleen 6, as strengthening and lifting the energy back up, specifically if it's taking the person obviously a lot and down. Now, there's a lot of symptoms that come after COVID-19. For some people, it's cough. For some people, it's poor memory. So you have to do a full diagnosis to try to figure out what is the best treatment. But hopefully, Chen, that answered your question today. Thank you for asking it. I really enjoy when people ask questions that, I feel that I could give some kind of impact and some kind of answer that could help you. So I'm looking at everybody coming in today. So I'm just looking at more comments, you guys. I'm just going to go back to the comments so you guys can see as well. What's your treatment and vision about stress and psoriasis? See, I can't speak English. So this is a tough one, Tom, to answer. Because when it comes to I can't say that word, psoriasis, my tongue went twisted. So when it comes to psoriasis, you have to do a TCM diagnosis because everybody would be different. Some people are more blood deficient. Some people are more excess heat. It depends, right? When heat, there's a lot of different patterns. But you want to reduce the stress. You're absolutely right, because the stress increase the outbreak or increase the skin issue, right? So what I would do is think of when you put someone in acupuncture, the goal is to put them in a parasympathetic state. Okay, so fight and flight is the central nervous system in a sympathetic state, right? We have two systems within the central nervous system, right? Sympathetic, that's fight or flight, or parasympathetic, which is more rest and recover. So putting them under with acupuncture is to make them rest and recover and de-stress. So acupuncture is really good to de-stress the person. And so depends what their diagnosis is. Basic points would be yin tong, would be liver 3 because it moves qi, it relaxes the body. And looking for the root cause. The problem with psoriasis or any kind of disorder is you're going to need to look for the root cause. And that's what TCM is really good at, is looking for what is the root, what started, what makes it worse. Sure, stress makes it worse, but what is the root cause? Is diet something that we need to address, right? Is it something else that's coming from hormonal imbalance? Is it something that's coming from medication or drugs, right? We have to look at the root cause to try to see if we can manage it or if we can actually change it, right? Because sometimes we can't control the root cause. So hopefully that answered your question a little bit. Okay, so Yolanda had a question. Yolanda says, which is the best acupuncture point for spleen qi down? Okay, so I assume you're meaning spleen qi deficiency or spleen qi sinking. So it depends, right? If it's just spleen qi deficiency, for example, spleen qi deficiency symptoms are going to be fatigue, weakness, specifically in muscles, loose stools, poor digestion or weak digestion, poor appetite, pale lips, pale tongue, etc. The person's probably worry a lot, overthinks a lot, so they're drained probably physically and mentally. So in general, it depends, right? Which point. But what I would say is stomach 36 and spleen 6 and Ren 6. This is all sixes. Stomach 36, spleen 6, and Ren 6 are really good to tonify qi and spleen qi and stomach qi. So that is a good start. After that, it depends. If it's more of a digestive issue, like weak digestion, I would do spleen 3 because it's the best point. It's the yuan source point of the spleen. So it's the best point for transforming and transporting. So basically for digestive or absorption issue, right? If it was more of an issue that's affecting the mind, like the person is overworked and they're worried and overthinking and their mental is drained, then I would do more spleen 5. Spleen 5 is the best point when the mind feels exhausted from worry and overthinking. So there's a lot of options there, right? You have to do your diagnosis, see what's going on, but that's a good question. So hopefully that answered your question, Yolanda. Okay, India by a Tibetan. Oh, I love it. We're in great places all over. I know it's really late for people in India and Tibet and in that far away. It is, almost 1 o'clock in the morning. So thank you for being here. I really appreciate that. Nanette, hi. And so I have a question. Okay, so let's look at this one. What's the best treatment for long-term chronic kidney yin deficiency that is now affecting multiple other organs and starting to create blood stasis? Wow, that's a very specific question. Okay, let me erase this and then let me pull that question so we can all see it. Let's see, I can pull that question so we can all see it. And then I'm just going to do this. Sorry, and I'm going to re-pull that question. Okay, so we can all see it, right? That's good. And I have a bit more room with my board and my George, right here, the George. Okay, so what's the best treatment for long chronic kidney yin deficiency that is now affecting multiple other organs and starting to create blood stasis? So That's a big question. So kidney yin deficiency is always tough, right? Because anything that's affecting the kidney, yin or yang deficiency, or qi deficiency for that matter, if there's any kidney deficiency, it's always tougher because the kidneys store essence. It's our aging reproductive system. So if the kidneys are affected, it makes it tough. And if it's long-term chronic kidney yin deficiency, it makes it really tough. But it doesn't mean it's impossible. It just makes it really tough. And you're right. If the kidneys are deficient for a long time, it's going to create other issues, right? So for blood stasis, again, it depends what the symptoms of blood stasis are. Usually it's purple and pain, right? With blood stasis, there's circulation issue, and there's usually pain. So we want to open the gates, liver 3, Li4, those are your basic blood stasis, and then you can figure out where the pain is. But for the kidney yin deficiency, so you can use acupuncture, and you could start with basic points like kidney 3, kidney 3, kidney 6, right? That's your basic points, and spleen 6. Now, I don't know the person's symptoms, so if there's night sweats, kidney 7 would be a good one to add up. If there is palpitation and insomnia, and the heart is also affected, which is quite often the case when there's kidney yin deficiency, heart gets affected, and then there's a disharmony between heart and kidney. So usually if the kidney yin is deficient, heart will be affected. So I would also put heart 7 to calm the mind as well, and heart 6 if there was night sweat. So kidney 7 and heart 6 if there was night sweat. If not, heart 7 to calm the mind. So that's a basic kidney yin deficiency. Now with kidney yin deficiency, it dries the fluid. So it's really important to add up a really good diet that nourishes the kidney yin, like bone broth, like seaweed, like seeds, specifically like black sesame seeds, food like blackberries. Those are really good to also nourish the yin, right? This is quite important as well. There's also a formula that is really good for kidney yin deficiency, and that formula is called Yu Wei Di Huan Wan. And again, don't correct me on my Chinese. I can't speak it. I can't speak Mandarin. I know my formulas. I understand a lot of it, characters and everything else, but I can't speak it with all the tones and the 4 tones. It's like, I can barely speak English as it is. So Liu means 6, Wei is kind of like ingredients, and then Di Huang is the king herb in that formula, which is actually Shu Di Huang, which is Rehmannia. For people that do Latin, it's Rehmannia. And Wan means pallets. It's just the form it comes in. So Liu Wei Di Huan means 6 ingredients, and Shu Di Huang is Rehmannia, which is the king in the formula. So there's 6 herbs in that formula, and it's very, very, very good to tonify kidney yin deficiency. Specifically, Rehmannia is really good for that. So it's a really well-rounded formula. It's a formula I think is very well-rounded in TCM, and it's very basic and classic formula. So hopefully that answered your question. See, I love this Q&A. This is awesome. Thank you for the question. I love it. Eva, hi Clara, I love it. Okay, I'm going down the list, you guys, so I'm just going too slow, but I want to make sure I answer. This is a Q&A, so hopefully we're all learning from all the questions. So Melika says, how about chemotherapy in case of spleen Qi deficiency? Which point? Thank you. Good question. So you mean post or during chemotherapy, right? I assume that. So, okay. So I'm going to do 2 things. The first thing, this is for everybody. And this is a great question, Melika. I'm going to answer it. But I still wanted to say that if you go to my website, and if you go to, let me see where we are. If you go to my resource page, which is right here, the resource page, I have lots of treatment principles and protocol that you can get there. So make sure you do go to acupunctureacademy.com resource page. In that page, I will have treatment protocol for cancer patients. So you will have the whole thing there. It's totally written there. It's completely free. You can go and check it out there. So it's just for me to answer your question quickly by saying that, you're welcome to go on the website and do that. In the meantime, okay. See, this is why I have a board. I feel like I'm back in school. So Milika asked, how about chemotherapy in case of spleen Qi deficiency? Yeah, so during chemo, a lot of symptoms will come up, right? Nausea, vomiting, fatigue, loss of hair. But fatigue and nausea are probably the most important one because it makes you feel so bad and crappy, you can't think of anything. During chemo, there is a lot that happens. Qi is depleted for sure. Spleen Qi, kidney Qi is depleted, but there's also a lot of heat that comes up as well. So we want to tonify the spleen by spleen 6, stomach 36, Ren 6. It's all sixes. See how the same points keep coming back. But we also want to protect the kidneys, right, by doing kidney 3, kidney 6. And probably a couple of points to clear the heat because chemotherapy or radiation really creates heat. So that's also something that we want to do. Not a lot of points, but maybe Li11 would be a good point to add up as well. So hopefully that answered your comment, but there's way more on my website and you'll have all the answer in there. So Malika, I hope that helps. Chen says, stop. I'm glad I answered your question. Okay, DVJ. What are good points treatment strategy for chemotherapy patients? Okay, well that answers your question. So you guys can totally go to my resource page and do exactly that. And I'll for people that are watching the replay, I will put the link below in the description so you can go directly to it. Hi from Holland. Hi, my Netherlands people. Paul is asking, what diagnosis and treatment would you recommend for swollen tummy due to gas buildup, constipation, and inability to have solid stools? Okay, let's see that. Okay, so again, Paul, I will say it would be great to have a TCM diagnosis, right? So gas buildup, inability to have solid stool, and constipation. So that looks to me like a little bit of liver Qi stagnation, over-controlling spleen, creating spleen Qi deficiency. Because if there is no solid stool, that's a spleen deficiency or a spleen Qi deficiency. But if there's constipation and gas buildup, things are not moving properly, right? So it could be a liver overact on spleen or a wood overact on earth. So there is a few things you could do. AcuPoint perspective, I would start with the digestive diamond. This is very simple and easy, right? You have the belly button and you have Ren 9, which is great for bloating. Ren 6 to balance the digestive system and strengthen the spleen. And stomach 25 because it is here we go, that's a diamond. This the front moo point of the large intestine, which makes it a really good point when there is large intestine issues. So I would say this is a good start, the digestive diamond, when it's local, on the local area, if the person is okay with you touching them there, because sometimes the bloating or the pain is so uncomfortable that it's kind of hard to do that. You also want to strengthen the spleen, right? So I would say stomach 36, spleen 6, and spleen 3. Would be great because spleen 3 is one of the best points when there is malabsorption or issue with digestive system. It's the urine source point, of course, spleen 6, which is one of my favorite points because it tonifies spleen, it moves liver, which is good for the constipation, and calms the mind. Because what is the root cause of all this? Is this diet, right? This is treatment, but we still need to look for the root cause. Is this diet? Is it emotion? Is it stress, right? We need to figure out the root cause so we can address and go back. Remember, TCM is definitely a medicine when we look at the root and not just treat the branch, right? So this is treating the branch, but we still need to figure out what is the root cause always. So you could strengthen the spleen, and then I would do liver 3, right? Because you want to move liver Qi and address the fact that liver is a bit stagnated with that. If there is a lot of loose stools and gas, also spleen 9 is good because it's great for excess dampness due to spleen Qi deficiency. Hopefully that answered your question, Paul. I'm going pretty fast, you guys, but I'm trying to answer this question, and I love, love, love your questions, you guys. So thank you. It's the first thing, thanks. Yes, Yolanda, you're absolutely right. Spleen 3 sounds helpful, thank you. You're very welcome, Paul. Manish says, and Chinese herbs are needed along with acupuncture. Is Chinese herbs needed along with acupuncture, or acupuncture alone is sufficient to cure the disease? Oh, this is a big question. I love to answer that question. This is a great question. So the reason it's a great question is because it's important that we do understand how Chinese medicine work, right? And so the first thing I want to address, and Manish, I'm not trying I love your question, right? But I want to say, I always say we don't cure anything. And acupuncture itself does not treat or cure anything. And it's like, what? Why am I doing it? Acupuncture triggers the body self-healing ability. So that's the first thing. Acupuncture can help the body trigger itself to decrease inflammation, to rebalance itself, to reach homeostasis, and to self-heal. That's what acupuncture does. So that's what I wanted to address, right? It doesn't cure or treat anything. It tells the body what to do. So that's the first thing. And that's how I explain it to my patients all the time. Chinese herbs, on the other hand, Chinese herbs are a lot more potent. They also have lots more side effects if they're not used properly with the right patient. Okay, so it's really important to understand Chinese herb before you use them, in my opinion, because you want to make sure that you don't create any issue, right? The wrong treatment is not good. So it depends. So to answer your question, it depends on the disease. It depends on the TCM diagnosis. If the TCM diagnosis is, liver Qi stagnation, acupuncture can totally balance it, move the liver Qi and release the stress. Absolutely. If the problem is genetic, probably not, right? So then we're going to have to manage it and manage the symptoms. It's the same with herbs. It depends. It's going to depend on the disorder and how long the disorder has been there. So I know that's like a big non-answer, but I wanted to try to answer this because I know that's a question that comes in quite often. So thank you for asking, Manish. I appreciate that because I know that's an important question. Okay, there would be one more question. Yolanda, you're like, yeah, I'm here now. I'm going to ask my question. Of course. What's a good point for a very bad myopia? Like an advanced case. Thanks for answering the first question. Again, Yolanda, we're going to have to do a TCM diagnosis, right? So this is what is really important. And this is why I'm going to take a little pause in here to answer your question, but to say something. This is why I created this book, right? The reason I create this book, which I'm selling the PDF or the hard copy, and the feedback in the last few days has been amazing. People are like, this is so awesome. This is so helpful. The reason I created this book is because I wanted to make TCM diagnosis easy to understand, and so you can use it in your practice. And because it's really important to have the right diagnosis in order to pick the right point, right? If you don't know if your patient has blood deficiency or yin deficiency or liver yang rising, how are you going to choose the points that bring the liver yang down or tonify blood or nourish yin, right? So we want to make sure we have the right diagnosis. So this is why I actually created this book, by the way, and I'm so proud of it because a lot of people have sent me a lot of great feedback, and it's been amazing, the feedback. So that was my side note there because I wanted to answer that question. So Yolanda, myopia depends. If it's a KD Yin deficiency, if it's a liver blood deficiency, liver yin deficiency, it depends. So the problem is, without a diagnosis, it's very hard to treat. You can do points around the eye, for sure, to try to bring blood circulation to the area, but you will need a TCM diagnosis. So again, that's harder for me to answer that question. I'm sorry, I'm not able to do so today. Is it possible to get rid of a 9 centimeters cyst on the ovary without surgery, patient age 43 and not yet menopause? So MB, I like that. You know what MB stands for? Mont Blanc. So this is where I'm from. I'm from France, and I'm from Mont Blanc, which is the highest mountain in Europe. I'm from the French Alps. So I know it's not what it stands for, it's your name, but I think it's kind of cute. 9 centimeters is pretty big for a fibroid, and I don't think that, or cyst, sorry, that acupuncture can get rid of a 9 centimeter cyst. It can assist post-surgery to recover, But if it's that big, it could burst. It's quite dangerous. So I don't think it can. If it's really small, like polycystic ovarian syndrome, where there's small cyst and we change the diet, etc., I could see that. But if it's that big, definitely diet will make a huge difference. So no dairy, no processed food, no gluten, no sugar. That's the first thing to do, is to look at diet to help also so it doesn't grow bigger. But I don't think acupuncture itself can do it. Sorry, MB. I hope that answered your question. Sontaga says, may you briefly explain how you use stomach 17 as a landmark for measurement on the chest, and do patients need to be shirtless for an effective measurement? Okay. This is good. You guys have great question. I love it. Sorry, Manish. I'm going to take this one and put it up. Okay. So for male patient, yes. For male patient, stomach 17 is a great landmark. If a male patient is pretty trim and pretty slim in general, right? Or trim or slim in general. Yes, you can use it as a landmark. And yes, they can have their shirt off. No problem. For a female patient, we can't use stomach 17 as a landmark. I use mostly the clavicle. So from the midline to the acromion, the clavicle is 8. I use this as my landmark for women because specifically if women are heavy-breasted, the stomach 17, which is on the nipple, will not be useful at all, right? Especially when they lay down. So usually I use the clavicle as my landmark, and then halfway is 4, and halfway of that is 2. So that would give you your landmark. And again, it depends on how you drape your patient, but you want to make sure your patient is comfortable and they feel that they're trusting you in here. And so my dog just coming in. Hi, Boom Boom. Hi. He just woke up and coming in with his cone. Hi, my love. Sorry, you guys. This is what happened when you're live and your dog wants to come and say hello and scratch his head. So hopefully I answered your question, Sontaga, with this. And I'll go back to the next one. What do we have? Thank you. Is acupuncture safe for hemodialysis patient may have chronic pain? What do you think? Yeah, absolutely. Acupuncture is pretty safe for a lot of patients. It's just doing the right point and making sure you're doing the right diagnosis and using the right point. And specifically if people on hemodialysis or that have stronger or weaker, they are weaker due to really deep-seated diseases, I would not overdo it, meaning that you use less amount of needles, just the right one that will do the job. More needles doesn't mean better treatment. I'm definitely more from the person and perspective of the right needles will do the better job than putting like 50 needles in someone, which is way stronger, right? It's a very strong treatment. So for children or elderly or people who are very weak, 9 needles enough. 9 needles, that's it. That's usually enough for me. So hopefully that answers your question. Sorry. Okay, perfect. Yes, thank you. You're very welcome. Dr. Anwar, hi, well doing for acupuncture. Thanks, Clara. You're very welcome. If a point is tender, does that mean I should press it, acupressure? If there's any tender area, yes, it probably means that you'll need it. It's kind of like a little clue of the body telling you something, right? So if you're like on your forearm and then your extensors are sore because you did a lot of, typing or something, sure, that's muscular. But sometimes you didn't do anything and then you press, you're like, ooh, that's tender. Then yes, massaging it is probably a very good idea. Yes, for sure. Annette, do you always use point bilaterally? Oh, look at you guys having such great questions. No, I don't. It depends on my treatment, and that's why I said it depends on how many needles I'm going to treat with or help the patients with, right? So I'm like I said, I'm the one perspective or point of view that more needle is not good, is not better, but less needle is better. That's my point of view. Doesn't mean that it's everybody's point of view. So I will do bilaterally if I need those points to be really, if they're very specifically done. For example, when we were talking about the diamond earlier, yes, I want to put stomach 25 on both sides because we're treating the area and we want to really give it a power. But let's say I'm trying to help a woman that's got morning sickness due to blood deficiency. Okay, morning sickness due to blood deficiency. So, Annette, I'm just going to use my board so you guys can see better. And that's the question Annette had. So, if someone has morning sickness, which we know is stomach qi rebelling, due to blood deficiency, because they are depleted and they have blood deficiency, then the best thing to do is PC6 is your best point for morning sickness or nausea, right? That's a lot of women know that, even if they don't know acupuncture. And spleen 4. So spleen 4 is really good when there's blood deficiency or blood stasis affecting the female reproductive system, because it's the confluent point of the Chong meridian or the Chong vessel. And remember, all the 8 extra vessels carry essence. So they relate to essence, which means they relate to the reproductive system, right? So those 2 points, PC6 is also the confluent point of the yin wei vessel. So the yin wei vessel and the Chong vessel carry essence. And so those 2 together are great for morning sickness, specifically due to blood deficiency. So because she's weak and she's blood deficient, I don't want to do this bilaterally. So I will just do opposite side, which means I usually do PC6 on the left and spleen 4 on the right. So that's how I would do it. So if, because those 2 points are confluent point and they work really well for the patient at that time, I like to make sure that I use them together in opposite side, right? So I won't do bilaterally if things can be combined together, right? If you have someone that you need to move qi and blood and open the 4 gates, right? The 4 gates is liver 3 on the foot and Li4 on the hand, which is moving qi and blood. But sometimes that's too much for someone. You could do liver 3 on one side and like on the right side and Li4 on the left side, right? Like you could go opposite to work those points together without overdoing it. So hopefully that answered your question, Nanette. Okay, perfect. I'm going down. Perfect. Wow, thank you. That was very helpful. I'm glad, Paul. What are the points to support the women in second trimester? Eva is asking. So, yeah, second trimester for women, one of my favorite points would be kidney 9. So first trimester is always tougher, right? Because we're making a baby, right? In our belly, we're like making, which is crazy. You guys, this is like magic. Think about this. The human body is creating another body and growing heart and liver and skin and central nervous system and brain. This is so cool without doing anything. You just sit there and your body is creating. This is fantastic. That's why I think the body is magic. So to answer your question, the first trimester is a lot more to do, but the second trimester to support, you're right, to support women in the second trimester if they don't have any symptoms, right? If they're not, because sometimes they have sciatica or they have pain or they have, digestive issues or diabetes, gestational diabetes can occur. But let's say it's just support, right? And I have a lot of patients that I treat for fertility purposes. And when they are pregnant, I follow them through the whole pregnancy. So if the pregnancy is doing well, what we want to do is support with points like kidney 9. So kidney 9 is your best point to support the pregnant woman because it's called the beautiful baby point. So I always say it's going to make your baby beautiful. What it means is it's going to keep your baby healthy and your baby beautiful. So that's what I would say to my patients. That's why I love the beautiful baby point, which is kidney 9. And then to support them, I would keep the immune system and the digestive system happy. So stomach 36 does both. See, you don't have to put a lot of points, right? Stomach 36 is great for immune system and digestive system both. So yay, we're done with that. And then those are the 2 things. And then, maybe calm the mind if she's anxious or stressed, right? You could use yin tong, you can use anything that makes you feel like the person can calm the mind. So there's lots more to do depending on what her TCM diagnosis is. But as a basic thing, I would say stomach 36 and kidney 9 are definitely your basic point. And of course, do not use the counterindicated during pregnancy point, which we should all know, right? So that's my recommendation. Okay, so JB says, I hope that answered your question, Eva. I have pain on the right side of the neck that radiates down my arm, especially shoulder. During a massage, there was an extremely tender spot along and under the clavicle. Any suggestion? Thank you. Oh, it was right on you, under the clavicle, right under your rhomboids. Ooh. So, so it's hard to answer without knowing why you have the pain on the side of the neck, how long you've had it, if it's due to an injury, if there's scar tissue, if there's fascia issue, right? So, but usually, if it's really tender under the shoulder blade, there is blood stasis. So for us in Chinese medicine perspective, there's a lot of option. There's a lot of option because you could do distal points, you could do local points, you could do cupping, you could do electroacupuncture. There's a lot you could do. So I would definitely recommend you see a qualified practitioner in your area, and they could have all the suggestion that to help you with that. Hopefully that helped a little bit. Milika said, thank you for your answer. You're very welcome. Sensei, I love your name. This is awesome. Sensei, what points would you recommend for pain in the lumbar spine during pregnancy? That's a great question too. You guys have an awesome question. We're going to be here for like 6 hours. No. Let me drink some water. So, before I answer that question, by the way, I also have this book. So this is my AcuPoint Made Easy. When I talk about acupuncture point, this has all the acupuncture point of all of them, graphics, explanation, plus the 8 vessels, extra points, special points, everything. So this is also something that I created for people that asked for it. Everybody demanded that book, so I created it. And it's been helping a lot of students and a lot of people. And I offer the PDF or the hard copy, and they're both linked in the description below in case you guys were looking for it. Now, let's go back to answering that question since everybody wants to know some points. If there is spine issue during pregnancy, bladder 40 is great. The problem is bladder 40 is behind the knee, and it's very hard to do if the person is really advanced in pregnancy because they can't lay on the stomach, obviously. Most of my patients that are pregnant are going to sit up on the treatment table, so it's very difficult to do bladder 40. So what I would suggest, again, you want to do a TCM diagnosis, figure out what's the best point for that person. But if they have pain in general, that's in the spine, gallbladder 34 to relax the whole body is really good. It's safe during pregnancy, and it relaxes the tendons, the sinews, the ligaments. It relaxes everything, right? So that's a really good point for that, because we can't touch the sacrum or the lumbar when a patient is pregnant, right? So we have to do distal point. Another one that's really good for anything happening along the spine is small intestine 3, because it's the confluent point of the dew vessel. And the dew vessel is the one that's going all along the spine in the back, right? So this is the point that connects to it. So this is a really good point for that. Also, kidney 3 and kidney 6 protect the kidney, which gets affected during pregnancy because we use essence during pregnancy. And they're good for low back pain. So hopefully those are basic points, and that answered your question. All right, going down. Would you explain a little the blood relationship between spleen, liver, and heart, and how it manifests into physical, emotional pain and disharmony? Oh, Leo, that's a big one too. See, maybe I should do those Q&A more often. Look at you guys have so many different kind of questions. I love it. Okay, so let me go back there so you guys can see what's going on and we can all be here together. I'm going to move this a bit so you guys can see it better. So, first, spleen produces blood, right? Okay, that's the first thing. Liver stores blood, and heart moves blood. So, spleen produces blood from nutrients. Liver stores blood for menstruation, specifically, and energy. And heart moves blood, in charge of blood circulation, but the heart is also in charge of bringing blood to the brain and the mind for a clear mind as well. So if there is issue that is affecting the mind, then is heart not able to bring blood circulation to the head or to the brain? Because remember, blood is deemed to be the material basis of the mind. The material basis of the mind is blood. So if there's mind-affected issue, blood is often involved, right? Make sense? Okay, so to repeat your question, the relationship between spleen, liver, and heart, so we just talked about that, and how it manifests into physical, emotional pain and disharmony. So if spleen is not able to produce blood, then then liver cannot store it because it doesn't have enough to store because there's not enough produced, right? So it starts with spleen being deficient and not being able to. So that could come from diet, but that could come from also emotions. So the emotions can also deplete the heart mind, deplete blood specifically, and make people deficient as well. So there's a lot. I always love how TCM can be the chicken and the egg, right? So which one came first, which one is the root cause. But when it comes to affecting the body, spleen, liver, and heart blood relationship is either we get blood deficiency, blood stasis, or heat in the blood. Heat in the blood only affects liver and the pericardium, so the cover of the heart, which usually comes up with bleeding or excess bleeding plus heat symptom. When it comes to spleen, spleen can only be blood deficient, so that's what would happen. Liver can be liver blood deficiency as well, and we can have heart blood deficiency. When it comes to blood stasis, because liver moves qi and qi moves blood, you follow me? Liver moves qi and qi moves blood. So liver blood stasis, which comes with purple and pain, so lots of pain, usually like menstruation pain or pain anywhere in the body that's fixed in one area. Or heart blood stasis, which is more related to the heart system, the circulation, and cardiovascular like. So that's how it would go about. And so yes, emotions, physical pain can affect all those patterns. So hopefully I answered that the best I could, Leo, and that was answering your question. I heard that herbal formulas are stronger and more effective than acupuncture. Is this true? And if so, why? Okay, this again is a great question. It's not more effective than acupuncture, but it is strong in its power. So herbs have a really, really specific effect to different disorders that sometimes acupuncture cannot help, right? Because if you have, small little fibroids in the uterus, acupuncture is not going to get rid of them, but herbs could if they're small enough. Okay, so there's lots of things herbs can do that acupuncture cannot do, but vice versa. When there is pain or acute pain or chronic pain, acupuncture works really well. Herbs can help as well. For sure, there's lots of great formula for pain to move blood or to address the pain depending on what the pain is, if it's wind, cold, damp, heat, B syndrome, all those kind of things. So they both have their place. And sometimes combined, they make such a better outcome. But they both can be used interchangeably. So hopefully that answered your question. Love your PDF version of the book. Use it almost daily. Yay! Thanks, Leo. I'm so glad you enjoyed the PDF. Everybody's different. Some people like the hard copy, like that, or some people like the PDF because you can carry it in every device. Heaven Herf, I love that name. Hello, madame. Hello. KD says a patient has continuous pain after knee operation. So let's pull that up. A patient has continuous pain after knee operation and she gets much stress, insomnia, and depression. What do you think? What I have to treat first, the pain or the stress, depression, insomnia? Great question. The root, the branch, which one do we treat first, right? So if surgery was just recently, I would definitely address the pain because the pain is going to stop her from sleeping and it's going to increase her feeling depressed because she feels hopeless, like her pain won't go away. So I would really focus on the pain first because if it's just after surgery, you should be able to do a good job on it that we can manage the pain very quickly, right? Because it's so recent. And then the chronic issue like depression, stress, and insomnia, then once the pain is reduced, then I would do that after. So hopefully that made sense. That's how I would go about it. Okay. let's continue so you guys can see what's going on. I understood too many points in one session diminish the treatment effect. How many points are you normally using? Like, what is too many points at once? Yes, Anne, good question. It's not that it's not going to have an effect. I think it's my preference because I've seen it in years and years, almost 18 years of clinical practice, that I don't have to put more. It's kind of like, when they say a glass of wine, red wine a day is really good for you, or a piece of dark chocolate is really good for you. I'm the one that thinks that, 10 glasses of wine or 10 pounds of chocolate, definitely not good for you, right? So it's all about balance. And so I in my preference, I think that in clinical practice, I've seen it many times, it is definitely better for me. I see the better outcome for less points. So, in TCM perspective, to answer your question, we usually try to do treatments in 3, right? So, there's yin, there's yang, and there's the person in the middle, and we're trying to balance between yin and yang. We're trying ourselves to balance our yin and our yang. We're the person between the two entities, right? It's the idea of homeostasis. So usually I always say, first of all, nothing less than 30 minutes treatment is enough. So if you're doing 15 minutes needle and you take them out, to me, that's not enough because it doesn't allow the body to go in a parasympathetic state. Because sometimes patients, it takes a while for them to go in that state. So 30 minutes, it would be my minimum of treatment. Usually for most people, I do 30 minutes on the first time just to see how people do. And after that, it's usually about 40 minutes for most of my patients with the needles. Having said that, to answer your question, and your question, I'm going to post it out there so people can see, is how many points is best normally to use. So I always say between 6 and 21 needles is a dividing by 3, right? Because we said it has to all be by 3. So for a child or an older person, I would do 6 to 9 needles, stay on the lower side. For someone that's more excess, that has a lot more issue, 18 to 21, probably better. Everybody else in the middle. So it depends on each person, but that's my range, and that's how I teach it when I'm in school. So hopefully that answered your question, Anne. Okay. If I buy the hard copy, will I get the free PDF of charge with it? No, Manish, because the hard copy cost me money to print. So I basically charge you, if you want the PDF, for the printing cost of the hard copy for me, because the hard copy obviously costs me money to print. With the PDF, it doesn't. So hopefully that answered your question. Many, many thanks for the answer, and glad you like my name. That's great. Manish, I see discount for Chinese medicine book, but no discount for AcuPoint Medici. You are correct. The Chinese medicine book is discounted till April 15th, which is tomorrow here at midnight, because it is new. And for the first 2 weeks, I always give everybody a chance to do so. For AcuPoint Medici, it's 808 graphics and pages, and it took me 2 years to create, so there is no discounts. I'm so sorry about that. I give so much value, so much free content, that I absolutely think I should also value my time, my experience, and my knowledge. So that is why. So hopefully that answered your question. Please tell us, what is your opinion on tattooing over acupuncture points and meridian? Would it be better to have caution, or is there no interference with the system? This is an interesting question. My students ask that every single year. I don't know. And I don't know if there is data on this, but it is fascinating that we are puncturing the skin in an area or a point or a meridian and injecting a dye. So for me, personally, tattoos and piercing that are, affecting an area, I always think, I don't know. It'd be interesting to know, but I personally think that it could affect the person's meridian and area, because you are putting a foreign substance into the body. So, but that's my opinion. So that's all I could say about that. What is the treatment for Hodgkin's lymphoma? Haha, Yuri, I'm so sorry I can't answer that question, because, not that I don't want to, it all depends on your TCM diagnosis. Every single patient is how we're going to treat. We don't treat the disease. We always treat the person as a whole. with the diet, the stress, the emotional trauma, everything. We look for the root cause and we treat the person as a whole. That's why having your TCM diagnosis is important. We don't treat the disease. Again, we treat the person as a person. Because you can have two people with Hodgkin's lymphomas and be completely different people. Different gender, different age, different background culturally, DNA-wise. One person may have different symptoms than the other. They may have also different diet, different stress, different emotional trauma in the past. All this has to be taken in consideration. That's why I love TCM, but that's why it makes it complicated to answer that kind of question. So sorry, Yuri, I can't answer that right now. Thank you. You're very welcome. Thank you so much for answering me as well. Please continue your in-depth meridian series. Yes, I'm doing that. It's just I've been super busy lately because I also teach at a college and I have my practice. But I am going to plan to do all the meridians with all the points and all the location. So far I've done the large intestine and the lung, only 2, but I'm working on the next one, so it's coming. What would be the best point for diabetes? So Anne, it's the same thing I said to you earlier. First of all, is it diabetes type 2? Type 1? Big difference, right? So type 2, diabetes type 2 has to have diet involved because diet will make a huge difference. So is type 1. But with type 2, you can actually get rid of it, right? Diet is super important. So what is your diagnosis? With type 2, often it could be a spleen deficiency, but it's not for sure. With type 1, it's usually a yin deficiency, kidney yin deficiency, stomach yin deficiency. So it's a little bit different. But again, it's not just that. You have to do it for each patient. So sorry, again, we don't treat the disease itself, but we treat more the patient. Thank you very much for your work. You're very welcome. Straight from Long Island, New York. Woo! I just received your second book today. Can't wait to look at it. Oh, sending love, Gina. Thank you, my girl. Thank you, Gina. You rock. I really appreciate that. Thank you, Clara. Is there any acupuncture protocol for peripheral neuropathy? Diabetes, chemotherapy induced. That's the same thing. I would say with neuropathy, you're going to have to do points for pain. You're going to have to move blood circulation, but it's going to have to be patient specific. So yes, you could do LI4, liver 3 as your pain, and then distal point and local point where the pain is and where all the neuropathy is happening. So it's tough to say without knowing where it is, and you will have to do a TCM diagnosis. Is it due to blood deficiency? Is it just a blood stasis, right? So is it internal wind? So all this comes from, that's why I literally really emphasize on making a TCM diagnosis, then you can pick the point. So hopefully, I'm looking into doing a treatment book next because I know people are asking this and seeing the main pattern in each of those main symptoms. So to help everybody, I'm looking into doing this, but that's going to be a big work, so I haven't started that. Sorry, Liana, I wasn't answering your question that well, but that's all I could say. If looks could kill, you'd be a weapon of mass destruction, miss. Okay. I love it. Michael, thank you. Excellent. Oh my God, that's so funny. I'm glad in my 50s I still turn heads. This is making me happy. Christian says, I am an I Ching serious student, and I found that all lateral disciplines like Badger, Feng Shui, and TCM are very complementary to my studies. You're absolutely correct, Christian. I absolutely love that. Due principally to the yin yang, the 5 elements, yeah, and the thinking in general. I have your channel among my preference in this area. Oh, I love that, Christian. Thank you. And I have to say that, you're doing I Ching. I'm deep into the gene keys right now. So if you guys have ever learned about or talked or heard about the gene keys, go to genekey.com. And if you don't know what that is, it's called genekeys.com. And you can calculate your gene keys, which is when you were born, where you were born, what time. And it's really using the I Ching, which Christian was mentioning, to tell you what your character is, what your purpose is in life, what is your life characteristics. It's quite a lot of fun, so I absolutely love the gene keys. So thanks, Christian, for sharing this with us and the I Ching, because I love that too. High blood pressure, thanks. So Albina, I am going to send you I'm not sending you, but I'm sending you here. If you go to my website, AcuPointAcademy.com, by the way, you guys, it's just me. A lot of people think I have a team. It's just me. I do everything, the content creation, the website, everything. So if I don't answer you right away when you text me or DM me, please be patient because sometimes I get a lot every day and I answer it all. So I just wanted to, let you know that. Albena, if you go to my website under resources where it says treatment protocol here and case studies, you click that and you will see the treatment protocol for high blood pressure. It's all in there. So the reason I'm sending you there is because it depends on the diagnosis. It depends on the TCM diagnosis. I put all the patterns that are very common patterns with all the points and all the symptoms. So that should give you an idea. I mean, you could use liver 2 to bring it down. You could use kidney 1. There's a lot of points, that are specific to high blood pressure. Your acupuncture as well, but it's better if we do a diagnosis, right? So if you go there, you'll get that answer. Great explanation. Thank you, Leo. You're welcome. Thank you kindly. And what is the best way to learn the AcuPoints? That's not easy, right? I was going to say, get my book. No, I'm kidding. The best way to learn the AcuPoints is repetition and more repetition. When I was in school, I remember thinking, how am I going to remember all those points? And you know what? It wasn't as hard as remember all the herbs and all the formulas, which are all in Chinese. So the points are actually easier if you have to remember the numbers. If you have to remember the name, it's harder. But if you have to remember just the numbers, stomach 36, etc., it takes time and repetition. I know it's not easy, but eventually it comes. I promise you. You give so much. I wish I could buy all your work and more. Thank you. Oh, thank you, Chun. I really appreciate that. You know what? I'm here to make an impact. I'm here to give as much as I can when I can because I love TCM and I want everybody to benefit from it. And if I can help you guys, then you can help 20, 30, 100 people. So it's like it's spread and it's just an exponentially big effect, right? It has a bigger impact if we can touch more people. You're very welcome. You're right, Clara. You must value your time and experience. We are very lucky to have you. Oh, thank you, Liana. That's very sweet. If someone has a weak constitution, primary amenorrhea, and fertility issue in both the patient and their sister, but there is not enough to be Jing deficiency, could it be considered a Yin deficiency? It's tough. So this is the question. You guys can see the question here, right? It's tough, B and C, because it could be anything. It depends on the symptoms, right? It could be, first of all, if it's primary amenorrhea, if you never had a period before and the sister never did, I would say it is a kidney essence deficiency. Yes, it could be a kidney yin deficiency with or towards kidney essence deficiency. You know how there is degrees of deficiency? So kidney yin deficiency towards an essence deficiency, that would be it. So that's a tough one to treat, unfortunately. So yeah, you're absolutely right. And says, hi, Clara, in my second year, would you recommend any tips to study formulas? Oh my, yikes. And formulas are tough, right? I don't know how many you have to learn, but I know we had to know 171 formulas with all the herbs in each formula. I created songs. I created a lot of songs when I was in school, and I was way back when you had tapes, and I would record myself in the tape, and I would put the tape in the car, and I would listen to the tape while I run or while I work out or, as much as I possible. So what I did is I created songs with the herbs, or you can make cards. There's also a gentleman that I think his name was Mark something. That was way when I was in school. And he creates herb cards with really cool drawings as well. And I think it's herbzoo.com. Try herbzoo.com. It's a really, really good herbzoo.com. And I remember using that as well in school. You must be an energizer bunny. Sometimes, but I still need my yin time, right? After this, I'm going to go and walk my dog, and we're going to sit in the grass, and we're going to do a little yin time because this is very young, right now, you guys. Will acupuncture be enough to treat deep problem, or do we need a herb prescription along with acu? It depends. It depends on each disorder. So I answered that question before, Devasam. So I'm so sorry. I'm not going to do it again. You can watch the video. This is going to replay later on, and you can watch it. It depends on the disorder. So that depends. Sorry about that. Women's chest cancer, please. So Munir, I don't know what that means, but I think I understand your question. You're talking about how do we treat breast cancer, right? I assume that's what you're asking. It's a big subject. Obviously, I assume the person's going through chemotherapy. So again, you can go to my website on this one, and I have a whole treatment protocol on my resource page that is going to look at supporting patients going through chemotherapy and radiation and help them go through this with acupuncture. Acupuncture is really good to lessen the side effect of chemotherapy. So it's a really good help. So hopefully that'll help you. Did you say you have 2 different books? I only see Made Easy on your website. Oh, so below this video, there's the link for the 2 books. So I have this one, which is the Chinese Medicine Made Easy, which is all about foundation, like the 5 element, the yin yang theory, and diagnosis, how to use inquiry methods and the observation method with tongue, with pulse, everything. So that's the one that is below, and that's a new book. It's not on my website yet. I haven't even had time to put it because it just came out 2 weeks ago. And then the AcuPoint Made Easy is also below. So the link is below, and you can check both of them out. Thank you for the question on that. I really appreciate. When will you have and how to use herb formula book? Oh, Esther, I know I've been asked that lately, so it's going to be in the work. It just takes me time to create all those. I wish I could have more hours in the day to do this, to provide as much information to you guys and really help you, because I know it's helping a lot of students. My content really does help people, and that makes me so happy. It's very rewarding. So I'm going to work on that one, but I don't think it'll be this year. I will think it'll be more next year. Okay, so Anasser, I got it. Thank you so much. Can I buy your books from Algeria? Yes, Mounir. Tu peux acheter mes livres. Ils peuvent être envoyés en Algérie. Tu vois comment ça marche? Yes, you absolutely can. You can buy the PDF as well if you don't want to buy the hard copy, or you can buy the hard book. So, j'espère que ça c'est... Oui, ça va? Okay. Si j'ai répondu à ta question. Oh my God, look at this. I get to speak French. This is awesome. Thank you for everything you're doing to help us. You're very, very welcome. You guys, this has been amazing. I am going to close it down right now just because, you know, I've been at it for an hour and 12 minutes. And so I'm really, really happy you guys showed up. I really, really appreciate that. Thank you all for coming, for being here today, for asking amazing questions. I hope I was useful. Thank you for all the support and all social media. Keep supporting me so I can bring more to you every single time. And thank you for everything that you are doing in the world to change patient's life one patient at a time, by helping them, by changing the lives of everybody. So thank you, you guys. You're a rock star. Have a fantastic rest of your week. You found everything you need on my website. Check it out, or below in the link below. There's lots. I have free courses and everything. So make sure to take advantage of all the content that I offer, because it's there to help everybody. Thank you guys for coming from all over the world. You rock. May the Qi be with you, and I will be back on the YouTube Live very soon. Bye, guys. Bye. That's awesome. Bye.